don't want to be, but why? Because it's 100% statistically fatal. There have been a handful of survivors that maybe receive partial treatments, but certainly from a statistical standpoint of those over 50,000 every year across the globe, we don't want to be talking about rabies clinical signs in humans. So just about everything we're going to talk about today is to prevent these things from happening, but I did think it was appropriate to include it. Mainly from an incubation stage. Like, that is a common question. I'll say that again. How long do I have to worry about this? Well, we need to take worry out of the equation and follow your doctor's advice, decide what form of treatment you need, but typically 1 to 3 months is an incubation period, and as we begin our prodromal stage, flu-like fever, headache, malaise, tingling at the site, nausea, vomiting, that's irritability, insomnia. How many diseases would fit that, right? And how many people feel those things when you have anxiety over an animal bite? So that's sort of where what I call the cat chasing its tail. It becomes, you can't really pick it out at that point because the anxiety has caused those signs, or we now have been exposed to the flu. So occasionally we've run into where we will have an internal discussion about maybe someone has started their post-exposure prophylaxis, but now they've developed the flu and had to work around certain situations like that. So again, we do not want to be discussing human clinical presentation, but in the literature, hydrophobia is probably number one. Fear of water. Don't want to drink, and that actually was a human and not an animal, although it gets pinned on a lot of animal clinical signs and inability to breathe. Take-home message here, 100% fatal. And the term I like to use is we like to think 100%. We have recently had one PEP failure, but that's being investigated as to whether it was administered correctly or not, but 100% preventable as well. So very quickly after we say it's 100% fatal, we like to say it's 100% preventable. And this prevention versus treatment, a lot of people think they're being treated for rabies. Well, no, the treatment is for the animal bite itself. You are receiving prevention in the form of a treatment. So on that level, we don't really want anybody to think, hey, I'm getting treated for rabies, because in all honesty, they wouldn't be talking, they wouldn't be coherent enough to realize they're getting treated for rabies. And we're not even going to talk about that. There are some protocols out there to talk about humans that have failed, and the PEP has failed, but that's certainly not our emphasis today. So how many humans get rabies in the United States? This chart here, this graph shows 17 cases were documented, and from over the last 10 or 11 years. That's not many. It's not many because we give, and this is an estimate, I know this is an estimate because PEP is not reportable in the state of Alabama or in a lot of other states as well. In fact, it's not reportable in more than it is reportable. So over 100,000 people, it's estimated, PEP doses every year. So certainly that's the reason. So we don't want to think the reason that we're any different than somewhere where some of those 50,000 deaths are occurring. The only reason is because of our public health infrastructure and what we do. Across the globe, we know there is the K9 variant, and then bats, and maybe there's some reasoning behind this. The affinity to be able to induce rabies in humans may be better than, say, it does in a dog or something. But bats are primarily the cause of human rabies in here. And I think some of that it may be pathophysiological. It also is probably mostly rooted in the fact that people don't associate bats as a risk, or people don't just, oh, the bat's cute. A baby bat is very cute. I'll take a picture of it. We'll rehabilitate it and put it on Facebook, and all of those things are I only bring them up because they're really real life things that have happened. But it is really trying to get the public aware that bats are a risk. Okay, and we'll concentrate more on bats also in the program, because we do account for a lot of those non-bite exposures. So I was going to say that you may not know if you've been bitten by a bat. Now, I think most people are going to know if they're bitten by a bat. If you've ever seen a bat, their teeth are razor sharp, and there's substantial teeth too. So I think I'm certainly going to know it, but there may be some segment of the population, medical conditions underlying, where they may not know it. So we afford a lot more leniency on someone's potential bat exposure versus did a dog bite you? You know, like, is this a visible wound on your arm? So, okay, just across the United States, if we look at these human cases, we see that primarily bats make up the majority of these. These are all human deaths, human cases. Now, these are not exposures. These are exposures that we hope, as a health department, we hope that they went unreported, that someone just took their own health into their own hands, and that we had no part of this, or these states had no part of this. And this is my goal here. I never want to see Alabama on this list, and again, I say that just because, you know, it's not to say that these states did anything wrong. It's just really they were unlucky, right? They're unlucky. Also, travel-associated dogs. You know, most people that are traveling are informed enough to know that canine rabies exists in other countries. And then organ transplant, man, that is almost something that's very uncommon, but you talk about out of your control, right? I mean, that's almost, if you die from rabies following an organ transplant, I have trouble thinking about any way that's less your fault, you know. But nonetheless, those are more reasons of why we have human fatalities, causes of human fatalities. So let's move on to objective 2. Lee, do you have anything to add on any of that, objective 1? I know we covered a lot, folks.
No, I was just gonna, you talked about bats, taking pictures, putting them on social media. Social media, I think, has significantly encouraged the human population to go out and buy the cute little Highland cows. Mm-hmm. The exotic animals, monkeys are seen all over TikTok, and how they're taking care of monkeys. And, there's no am I correct that there's no rabies vaccine for monkeys? Different exotic animals that people are bringing and buying and bringing into the country all over the United States. Through the years, I've been really surprised in what little I've known, but all that together is called translocation. Right. And from a human health, and we even had one instance of where, not to get into the real particulars of, we have raccoon rabies in some Alabama counties and some we don't, right? And the risk was, fostering baby raccoons, taking these baby raccoons from, and this has been 10 years ago, but taking them from an endemic area to a non-endemic area
that has huge human implications, but it also has very large wildlife implications, especially back to that program of where, hey, we're monitoring this. We kind of know where we have it, where we don't. This is where we're going to drop our raccoon ORV baits, so
Right.
we know.
And to, with the public, it's human nature. You see a stray cat at your work and you're going to feed the stray cat. You don't, the stray cat ends up having a litter of litter of kittens, and then the free kittens are given away. Same thing with raccoons. I mean, people love to feed raccoons on their back porch. They're cute. I'm not going to say they're not cute, but the importance of knowing that rabies in raccoons is extremely high, and try not to get them to come to your house by feeding them, and if you do have pets, to put their bowls up at night and not to attract raccoons.
Thank you.
You're welcome.
And we've also used, and I know you've told me in the past, in part of your detective side of you is used Facebook. As sometimes people kind of hide from us, don't they?
They do.
They don't really want us
do.
to come knock on their door or the location of that raccoon. So
That is correct.
Okay, so now we need to talk about understanding the reporting procedures, and essentially this is the way that we as a health department are going to be notified. So what gives us this authority? It's under the Alabama Notifiable Disease Rules, Chapter 420-4-1, and on there you'll see probably 100 or so reportable diseases, 75 to 100, I guess. I admit I did not count them. All of these come with one stipulation, and that is time in which you have to report the bite. So with rabies and animal bites, so both things are reportable on here, and by and large, the vast majority of what we're talking about is going to be these animal bites. So someone has been bitten and they are seeking medical attention. Well, that medical provider has 24 hours to notify the health department. And basically what we're going to do with that is we're going to investigate that, who, what, when, and where, and we'll get to what we're going to do. But that is what gives, that is really what handicaps us the most, is if we never receive the animal report, the bite report. Would you agree with that?
Totally agree.
So, the ultimate role that we have is, again, I go back to, if we've received the report, we want a big fat 0 over there on our failures of PEP and our decision making. So in order to submit the report, we have a standardized exposure report form on our website that is accessible under the physician and provider resources. Along with that, we have, this is a partial list, but just a clip of showing each county's health department. Now, I will tell you, in my experience, some of the counties are used to getting the reports a little bit differently, or on maybe a form that the hospital has created or so forth. Some of them, as long as you know, you need to report the bite, right? And there's plenty of information out there. Even if it is not on this form, we'll take it in any form. But that is paramount. We sort of hopefully help, and we sort of hopefully help and not hurt, but oversee those and assist the counties when there are issues and so forth. But the bite reports would be going to the county health department. The samples themselves, when we talk about, we'll get to testing animals for rabies to determine if someone needs a shot. Those will be going through the county health department and then ultimately to our laboratory bureau. So again, this investigation's happening at the county level. And I like to sum it up: the who, what, when, and where. We need Lee, what's the most important information we need when it comes to investigating an animal bite?
Well, the most important thing that we need is we need all the information. We need the victim's name, especially the owner's name, because the owner is the one that will be ultimately responsible for quarantining the animal or euthanizing the animal and so forth.
One of the reasons I ask you that is I meant to, and didn't want to go backwards, but on that one thing to consider. But this investigation, once the Environmental Bureau at the county level receives the investigation, they're going to determine a couple of key things. First of all, what animal it is, right? And what was the circumstances of the exposure and so forth. So we're going to look into that a little bit deeper. But I also would say that sometimes we get questions at county health departments concerning animal exposures, meaning no human involved, but an animal that maybe my dog has been exposed to a raccoon acting strange.
And that happens all the time. Fido gets in a fight with a raccoon at dusk.
And then ultimately, we legally what the health department's going to do, when possible, when it's applicable, we're going to issue a quarantine order, which is basically a legal order, right? I mean, if you don't comply with our order, what happens? What can happen?
You can get a warrant or a summons out for your arrest.
So some people, unfortunately, it's easier to cooperate. And I think I'll just say this: a lot of times I think people just fear the worst, and I'm not exactly sure where this originates from, but oh my gosh, the health department's coming to seize my animal and to kill it and remove its head, right? So that's one thing we battle with. It sure would make our job easier if you just cooperate, and we're not going to do any of what you think. Just basically just clippets of a brochure we use to explain to these owners what's happening and whether or not that essentially the law requires, number one, that every animal in the state of Alabama, dog, cat, or ferret, shall be kept current on rabies vaccination, right? So there are different forms of that, and you should get with your veterinarian and determine whether you can get a 1 year or 3 years. So some variability on how you want to do that, but they need to be current, and that's the way the law now reads. But let's say you haven't done that and your animal bites someone, you're not going to be afforded those luxuries of being able to do a home quarantine. So this, under state law, you are being required to quarantine your animal for 10 days. So let's stop right there. Any animal that bites a person, dog, I'm sorry, I keep saying animal, any dog, cat, or ferret, and ferrets may have been in vogue back when the laws were written in 2008, and so I'm not sure. But
I don't think we've ever... I don't even think we've ever gotten a ferret
I have never
exposure, bite, or any... since
not
ferrets have
in
been
17
introduced.
years, 18 years. So most of those are probably just unreported, but
Most likely.
we won't talk about that. So let's start with the premise that any dog, cat, or ferret that bites a human being is going to be quarantined for 10 days, right? So we have to say that that's the law. Now, this home quarantine we're talking about came about several years ago because most states were enacting laws that, my dog has had rabies vaccinations for 12 years and he's 13 years old. And he nipped the UPS guy. He never goes out. He's in a fenced-in backyard. Chances he has rabies, so he was going to be basically under the same, and that chance is as close to zero as you can get, right?
Right.
So he was placed under the very same parameters or the very same requirements that a dog that had an entire 10 days. Nothing to do with the vaccine.
For a vet or home quarantine or vet quarantine?
Either one.
Well, the home quarantine, to comply, you have to take your dog to the vet on the 10th day for the vet to see that likely it'll get a booster shot. On the 10th day, for a vet quarantine, same thing. vaccinated for rabies. If it's never, it's probably never been vaccinated before,
Yeah.
and that's
Well,
the 10%. But I mean, it's under,
Yeah.
and that's
well,
the 10%. But I mean, it's under veterinary care. So if something should happen, it can be reported back to us. So if something should happen, it can be reported back to us that yes, it did.
Yep. It for the 10-day exam on the 10th day, and that's how we assure you that you don't need rabies post-exposure prophylaxis.
And it's important to note, too, that as environmentalists, we do contact the vet on the 10th day for the home quarantines to find out if, yes, Fido was seen at this vet on such and such date, and he was fine.
That and in
Fluffy
fact,
Fluffy's good.
That's probably our major role in rabies prevention from the county health department environmental perspective. We have to give the person that's been bitten assurance that these things have been done, that you do not need. Of course, we've hoped they've already gone to the doctor for the bite assessment. And basically what we're telling them is you don't have to go back to the doctor, to the physician, to get additional rabies treatment.
Right.
So we've talked about dogs, cats, and ferrets, but my goodness, we have had a lot of scenarios that don't really involve dogs, cats, or ferrets. And moving on, we'll see that creature there that has wings and very sharp teeth, the bat. Man, I could probably go on for the next 45 minutes about our bat histories here. But so bat exposures, we have to be careful with, because as defined, an exposure is any contact with saliva, a brain, or nervous tissue through open cuts in the skin. So, and routinely we're thinking that's a bite. However, with bats, we can't be so sure of that. We make additional exceptions or inclusions, if you will, of what could constitute an exposure. Take-home message for this is we're gonna put them through this. From a county perspective, we're going to put the information we get from the bite report through these flow charts and try to determine, whether or not the animals can test positive ultimately. And I won't read the flow chart, but ultimately making the decision of what how that person that's been exposed is going to proceed. So, and again, these flow charts for determining exposure maybe hasn't been vaccinated, and you know what? It may not be owned, and the legality of owning is really if they're feeding the animal, and I won't pull that up for you here, but in a lot of situations, the animals may not be at someone's house, but they may be in their neighborhood. So a lot of times what I have tried to make the recommendation through the medical provider is try to get an idea, is it likely, if it's been there, if it comes to your house every night, the dog, cat, whatever, it's usually a cat on this deal. Mm-hmm. A cat's been there coming every night to eat out of the food, a bowl of food that you put out for it, the chances are it's going to come back. And that gets to the question of, well, do they need to start the rabies post-exposure because they were bitten by a cat? It's not necessarily in confinement at the moment. And we'll get it. We'll touch on this briefly, but it does come down to sometimes where the bite occurred, like on the body, if it's far away. Remember, we talked about the incubation period, so we've got a little bit longer incubation period. So I like to think we've got 3 or 4 good days before we have to really start thinking about post-exposure treatment from perhaps a neighborhood cat that is probably going to come back in the evening. And then squirrels and rabbits. We get a lot of these.
And chipmunks.
We get a lot of these bites. And I will say the risk, they're a mammal. They can get rabies. You can infect these with rabies and they will become positive and probably shed the virus. The reason that we don't really recommend a lot of post-exposure prophylaxis on squirrel bites and rabbit bites and rodents in general is because the relative likelihood they would survive an attack from a rabid animal is pretty slim. And in the literature, we do make an exception for maybe flying squirrels that might have an affinity for bats and so forth. But living in the tree, living in trees with the bats, so the way that we typically address squirrel and rodent bites is if the rodent is not acting abnormal. And I got into this a little bit earlier when I said all squirrels act normal. So if a squirrel runs away up the tree, turns around, grabs a nut, and looks at you, he's probably not got rabies, right? So, so certainly, in my tenure here, there was one person that received rabies post-exposure following a squirrel bite, and that was he was sitting on the park bench. The squirrel aggressively came out of nowhere, ran up his leg, and basically just repeatedly bit the person and ran off. That person did receive post-exposure prophylaxis. And then a lot of the pocket pets you talk about, they've been born in captivity. They may not be vaccinated, but they've been born in captivity, never been out of captivity. Yeah. So, okay, so these are diagnostic labs. This is on the far left there. The test is actually a direct fluorescent antibody test. So that's how we would determine from a health department standpoint that animal is positive. Let's move along, Lee. We're going to get a little short on time here. So submitting samples. We get a lot of questions about this, a lot of complaints about this. We cannot be wrong as a public health laboratory. If we tell you the animal is negative, we cannot be wrong about that because that's absolutely, we might get away with it on a flu test or a strep test, but absolutely not on a rabies test, because somebody's life more than likely hangs in the balance of whether or not you're correct. So lots of stipulations on samples that we receive and the integrity that we receive, and ultimately the integrity leads to how we report those out. So any animal, and we're talking about here animals that were not qualified for quarantine, which would be which would be a bat, a raccoon, any wildlife species, cannot quarantine them. And in some cases, maybe even a squirrel, although we don't test a lot of squirrels. But if the animal's less than 15 pounds, and this is primarily directed most probably to veterinarians, less than 15 pounds and less than 19 inches, you can submit the whole animal. So this applies to a lot of kittens, which we've had positive kittens in the past. You just submit the whole animal. If it's a little bit bigger than that, due to our having to do all of this under the hood because of the aerosolization risk of the actual testing and opening of the cranium, if it's more than 15 pounds, it has to be submitted as a decapitated specimen. And now let's get into the really hard ones. Well, what do you do with terrible, if we have to have a horse's head submitted? Those are actually, we actually utilize the state veterinary diagnostic labs to help us remove those, and then the brain component will be sent to us. Take-home messages on these is, in order for us to give you 100% by guidelines set out, laboratory protocols, we have to have a pristine sample, and those pristine samples cannot be, for example, a bat hitting the head with a tennis racket or a dog shot in the head. Those things present huge complications when we try to test those animals because of the built-in safeguards that we cannot be wrong. So looking at and down at the bottom, you'll see a reliable rabies diagnosis requires a full cross-section of the brainstem and cerebellum. So we have to have that in order to say a sample is negative. So our public health infrastructure, we have a courier that will send those from all over the state. Any county you get it to, usually by 2:30, 3 o'clock, sometimes later in the afternoon. transferred to one of our 2 laboratories, Prattville or Mobile, and the results will be the next business day. So,
and they're packaged in with ice, and just like you said, the longer they're kept cold, the more likelihood that
yes,
it'll be a good sample to test.
We do run into that, and sometimes people's tendency to bury animals really quickly that maybe bit their grandson, and anger takes over, and something happens to the dog. We won't get into that, but the dog ends up buried. Well, now we're forced with looking at the grandfather saying, well, your grandson's going to take this pee we're about to explain. So
unless you dig up the dog.
Yes. So then the integrity of the sample becomes an issue, and that's when what you're talking about in terms of the temperature and so forth. So the DFA, the direct fluorescent antibody test, is the gold standard. There's some other tests you can do. You can always, some of these will be viewed as confirmatory testing. So we won't cover too much of that because we are going to get fairly short on time here. Submission forms. I'll just say that we want to make sure that no person is not notified following a positive sample. So if your positive sample, if you submit a sample and you're listed on this responsible party, and every sample that comes into our laboratory has to have this filled out. So every sample has to have this filled out. And if it's positive, you are going to be called first, second, or third, right? Depending on the order. It's usually first, but if there's any questions or so forth. But so that just highlights the idea of the emphasis we're placing on a positive sample. We don't want someone out there waiting on a sample. So that, again, that's very important that we have a correct phone number to call or a contact to contact them so that we're not needlessly sitting on information that can save their life. So, all right, I may not turn in the,
I don't think that's my slide.
You just slipped one slide. I think you skipped the bat slide. It's not in there. I'm sorry. I don't know what happened. I just
go back.
So we're gonna kind of go over this quickly, and I apologize about the time. I was worried about that. Lots of information. These are the guidelines for PEP. Take home message. Human Rabies Prevention 2008, and then that's the most current document. That document was, there was an addendum put onto that document, and it was the use of a 4-dose. So many of you will remember using a 5-dose vaccine. So we're talking about post-exposure, treating humans after either a dog, a cat, or whatever animal has been tested positive or was not found. Whatever our investigation led to, and determined that, hey, they need to receive rabies post-exposure testing. So on our website, we do have resources for physicians and other medical professionals that will help explain a lot of this that I'm about to go through. First aid on a next slide, please.
Sorry.
So in general, you always want to wash any kind of animal bite. And I consider this kind of more of an at-home treatment. You want to wash it, and I don't know if we can get somebody to wash it for 15 minutes or not, but using some sort of soap, and if you were to have any iodine, might help as well. But the idea there is cleansing, and we do know that does have an immediate impact on killing the virus, which is not extremely stable outside of the body. So, but once this person, and we will always advocate that they go see a physician, they're going to have to undergo, the critical part is to undergo this risk assessment of the bite to try to determine whether or not that person needs rabies shots. And we've talked about a lot of this already. Dogs and cats and ferrets, they can be quarantined. So if you think they're at home and it's an owned animal, even if it's a domestic animal and it's say a foot bite, a lot of times I'm like, what's the chances of being able to find this animal? If there's any chance to find the animal within a few days, generally I recommend waiting on post-exposure because we want to be the most prudent use of rabies post-exposure as possible. So sometimes we hear things like went to the ER, neighbor's dog sitting at home, someone started rabies post-exposure because it wasn't vaccinated. Well, the dog's at home, we know where the dog is, and so in that situation, regardless of vaccination status, especially when we're talking about dogs, cats, and ferrets, I like to say, what's the reasonable chance we can find this dog? Might want to not start the initial doses of post-exposure prophylaxis. And also you would have that, is it a foot bite, a hand bite, or something, something non-facial. Okay, take-home message here. Skunks, raccoons, and foxes, those animals cannot be quarantined, but they can be tested. So maybe depending on where the bite is, give it some assessment of can this animal be tested and how quickly can it be tested. And that's where I go back to we can test it, we can get you a result in 24 hours after receiving the sample. Okay, so in Alabama, the PEP is usually given in the emergency departments. We've kind of battled this through the years. It's very, very difficult to find physicians that want to sort of intervene into that, and it's understandably so. It does run very smoothly. I will just add one of the hiccups is kind of managing the costs sometimes associated with the emergency room visits, and I think that's something we all need to think about as professionals and involved in this arena is how can we address that? So we're looking at 4 visits, right? So that sometimes gets to be considerable. Okay, so what are you going to receive? We'll go through this very quickly. Rabies immune globulin, which is immediate protection, right? I mean, these are antibodies that against the rabies virus, so you're going to receive this. Where are you going to receive it? One of these 3, there are 3 products on the market. The first 2 are probably more commonly used. You're going to receive it right around the wound because if you think back where we talked about, the virus likes to attach onto that peripheral nerve, so you're going to infiltrate the wound. Is more concentrated. It's the newest product, and you just want to make sure and calculate the dose. The dose doesn't change, but the concentration has changed on some of those rabies immunoglobulin products. Now, the rabies vaccine itself, the standard dosage is now 0, 3, 7, and 14 days. So those are 4 trips. The highs of this is occasionally people can have an allergic reaction to one or the other. Realizing that because they're going to receive 4 of these vaccinations, they may need to switch products. And the other one is this does not need to be given in the gluteal area. It is just an absolute contraindication not to be given there. Response is known to the immune response is known to not be as great. So consideration. So that comes into play a lot of times. We're talking about infants, and we've had to recommend that infants get rabies shots before. I can think of one instance of where a child was in its seat eating dinner, and their mother left to go do something in the laundry room, comes back, and there's a bat in the kitchen, right? So very unfortunate, but that was sort of that more affordability we give to bat exposures. But just realize there are places that make sure you're reading the label on the injection site, and all of that is in the Human Rabies Prevention and the addendum as well. So, One of the other kind of highlights, and very rarely do we see this, but it does happen, a previously vaccinated person, whether or not they were they'd gone through the entire series because of an exposure, or maybe they had an occupational risk, like veterinarians. If they've had a vaccine, then they do not get the human rabies immune globulin. So just sort of a side note, doesn't happen that much. So some of the pitfalls that we see most commonly, H-rig is not infiltrated into the wound, and realizing if there's not a wound, it can't be infiltrated into the wound, right? So for non-bite exposures, that really doesn't apply. But where do people get bitten a lot? On the hand, right? And what's on your hand's fingers? Well, not, those are very painful injections. So ironically, people still ask, do I get the vaccine in the stomach?
I was going to say.
That's one of the most common questions. And I will say on film, no. Okay, no, that is no longer the practice. So the other one is sometimes we see vaccine given with no H-rig. And that's really going against the recommendations of treatment. The ACIP standardization of treatment is they receive both H-rig and subsequent doses of vaccine, assuming that they've never been vaccinated before. In my tenure, there's been one time that H-rig was kind of on very... It was due to a back order. There were you would have to order it directly. So at that point, we were giving vaccine with no rig, but as those patients were receiving rig before 7 days. So certainly, that's not something commonly you want to practice, though. Okay, that slide got put out of order. Let's go. Let's skip that. That was about my bat slide. Human rabies, these are, if you have a patient that you think has clinical rabies and that patient is no longer a candidate for pre-exposure, all of that needs to be coordinated through the state health department. We'll coordinate with our lab. Ultimately, those samples are going to be sent, and they do require all of those samples, CSF, skin biopsy, saliva sample, as well as blood. They require all of those to be sent to the CDC, but we do want to be involved in that. The CDC actually requires that we be involved in that. So we do that maybe one time every 2 years. So doesn't happen that frequently. Okay, so I'm gonna just kind of hit this, and then because I want to get to some quiz samples because we are out of time here, and so realizing pre-exposure does exist for some occupational hazards. Our laboratorians, veterinarians, animal control, animal shelters. Some people will receive pre-exposure rabies vaccine, and that is not the rabies immune globulin. Now, that is just rabies vaccine where you are inducing active immunity. Okay, so let's skip over our bite case examples, and I do want to be on record as saying some of these should have had a question mark afterwards, so I don't necessarily agree with the answers of all of these bite case examples the way they're written. So let's kind of skip over that and get to some questions that basically cover as a review. Lee, can I get you to read the questions?
Okay. Since 2015, what has been the most common source of human rabies cases in the United States?
Okay, and hopefully you're watching still, you will say that is at least not dogs, domestic, right? Because in other countries, maybe dogs, but bad exposures. And if you look at the list, remember the list was bad exposures, and that's why we are so honed in on mass bat exposures. We've had them in daycares. We've had them in schools, churches, campgrounds. Those have single-handedly led to the most people at one time receiving post-exposure prophylaxis.
All right, question number 2 is which animal can be observed for 10 days following a bite before deciding on PEP?
Okay, so this goes back to our shedding period, and we only know shedding periods for 3 species, right? And at least in terms of national recognition. And a bat's not one of them, a skunk's not one of them, but a dog, a cat, or a ferret are the only animals that can be quarantined for 10 days to prevent someone from having to take post-exposure prophylaxis.
All right, question number 3 is for unvaccinated patients. Which PEP regimen is correct?
For unvaccinated patients, which means this is the first animal bite they've had that they've gone and it's been determined that they need post-exposure. So the correct on we would call that day 0, they would receive HRIG, which would go in the wound, and any remainder that's based on a dose. So it'll be different volumes depending on the size of the patient. And then 4 subsequent doses of rabies vaccine on day 0, 3, 7, and 14 on adults, primarily in the deltoids.
All right, question number 4 makes me think of Forrest Gump, but where should rabies vaccines not be administered?
Yep. So obviously that is the gluteal muscles. Just the area there's too much fat, I believe. I think it's the muscle consistency which leads to the decrease in the immunoresponse. The only challenge there is going to be on infants and things with it becomes very challenging, but you can utilize the thighs.
HRIG product is more concentrated.
So I just put this in here just so you know that in case of those finger bites, a lot of physicians are liking the more concentration. It may not be applicable in every single patient, but there are products, but make sure you're still dosing it correctly and using the right dose based on the concentration.
All right.
And that would be hyper-rab. I'm sorry, I left that out. Hyper-rab.
True or false, rabies is almost always fatal once symptoms appear.
Yeah, and that is very much true, and we probably need to take almost always. We probably need to take almost out of that. Statistically, it is.
All right. Question number 7 is HRIG and rabies vaccine can be given in the same syringe.
That is a big, big no-no. Not only not in the same syringe, you don't want those to go in the same anatomical area either. So and that's all on the product label, but we certainly don't want to do anything to inhibit that vaccine response.
Okay, true or false? In immunocompromised patients, a 5th rabies vaccine dose on day 28 is recommended.
That's absolutely true, and if you remember that in prior to 2012, every patient was receiving 5 doses. That was the standard treatment. That was reduced to 4. So over the last 13 years or so, only been giving 4 doses. However, a 5th can be reserved. It can be reserved if there are any deviations from the recommended, even the intervals. Sometimes it's difficult to get a patient back in on time for 4 doses of a vaccine.
And this is one environmental sees, on occasion, a 45-year-old hiker wakes up to find a bat in his cabin. The bat flew away and is not available for testing. What is the next step?
Absolutely. I made a distinction on this case. I would like to see, there may be a few questions that you have to ask here. For me, the question would be, well, was he in a room with the door closed, right? And then if we don't find that bat in that room with it, that he was sleeping in, but if the door was open and he was sleeping, then, you know, he's going to need to, that patient's going to need to receive post-exposure. So,
And we get a lot, too, about hunters that are turkey hunting, sitting on the ground, stand up, find a bat, you know, don't know if he's been bitten or not because they have on all their,
yeah.
you know.
And just one more take home, our messaging is, you know, try to preserve the bat if at all possible. The reflexic action is to get rid of the bat as quickly as possible, get it out of the house, and then we're going to decide what we want to do.
Right.
Now, it makes that decision, what we're going to do, a lot more difficult.
The last question is, a 6-year-old is bitten by a healthy vaccinated dog that is available for observation. What is the correct approach?
Yep, everybody's followed the rules, so this one's gonna be a vaccinated dog is going to be qualified for home quarantine, and they're going to take that dog back to the vet on the 10th day. The vet's going to sign off. We examine the dog. The dog does not have rabies. He's going to notify the county health department, or the county health department's going to call and ask. And then we're going to call the patient and go, hey, you do not need rabies shots. The dog is out of quarantine. That's the easiest of the easy.
That's the best case scenario.
Thank you, Lee.
You're welcome.
Just the last slides there, some sources I want to thank. And I want to thank you guys, too, for hanging in there with us. I'm sorry we're a little bit over time, but I think that's it.
All right. Well, this concludes our program for today, and I want to thank Dr. Jones and Lee for being here, and thank you for watching.